Hello everyone, I'm Dr. Francisco. Today we're going to discuss one topic that is very important, kidney donation. I'm going to share my philosophy on kidney donation. The title of today's presentation is called Kidney Donation Holding Us Together for Longer. That is actually the slogan created by me of my own clinic in respective to kidney live donation and kidney transplantation, and I will explain what it means. But first of all, for those who tune for the first time, I am Dr. Francisco. I'm a specialist nephrologist and a transplant immunologist working at Francisco Kidney Medical Center in Singapore. This is the bite-sized information for kidney and related diseases. This video blog is destined to help patients with kidney problems or at risk of kidney problems or their relatives to be better informed, so they can take better control of their disease, minimizing worries, and to take better decisions with their own doctor, or with me if they choose me, minimizing complications. So, kidney transplantation or kidney donation holding us together for longer. As I mentioned, is the slogan of my clinic, and why I have adopted this slogan, you will learn why. Kidney transplantation is a beautiful experience that can prolong and improve lives of patients with kidney failure in comparison of their outlook if remaining on dialysis forever. Kidney transplantation can give patients a better quality of life by allowing them to regain their freedom to do many things that they used to do or used to enjoy before developing kidney failure and needing dialysis. Indeed, kidney transplantation is not free of potential complications or side effects of all the anti-rejection medications. But despite that, the majority of patients undergoing a kidney transplant live longer and fuller lives than if remaining on dialysis. Kidney donation is regarded as a gift of health and requires courage and conviction, especially by the donor. And it is an admirable act of love because kidney donation is not free of complications. But most donors do well through the rest of their lives. When discussing kidney donation and transplantation, it is commonly mentioned that donation is a sacrifice from the donor to benefit the recipient, so the recipient can do better. That is true in a way, but doesn't hold the whole truth. However, it is more than that. And seeing kidney transplantation and donation, especially its benefits, in one-way direction, gives actually patients extra worries, feeling in many instances to oblige to the donor, and even thinking that proceeding with donation or accepting the donation might not be fair to the donor, apparently putting the donor through such risk for their own benefit, for the benefit of the patient. Many of my patients have shared that sentiment, that feeling of, feeling a little bit selfish, like taking something from someone for their own benefit. Because many doctors preach it in that way, in that direction. Recipient receives the benefit from the donor, donor gives, recipient thanks. Just this one direction. I told you this happens indeed. The donor gives a kidney, is big thing to the recipient, but there is more than that. But in that way, when it's just focused in that direction, many times the recipient don't accept the donation because they feel a bit guilty, selfish. They are worried, concerned about the donor. It is my personal opinion, an observation, obviously, that this sentiment, has been, greatly created because seen in this one direction, just one perspective, when the recipient receives everything and the donor gives everything. But it is more than that. The benefits received are actually mutual and in both directions. Maybe not the same type, in the same way, in the same amount, quantity, strength, whatever you want to call it. Both there is mutual benefits in both directions, and beyond that, affecting even all the persons, all the people close to them. Kidney donation is a beautiful act, not a transaction, and therefore it should be weighed as such, in which, one party indeed gives some risk, but also can receive some benefits, as I will mention. And sometimes the risks are not as big as we think. Indeed, keeping your kidney is probably simpler for your body to work, and then you don't need to take so much precautions. But giving your kidney away in such a beautiful act sometimes even push you to actually live a healthier life, and many people can even do better than if they were not subjected to that, because they now take a healthier path. But anyway, let's go back to this. Indeed, kidney donation has been regarded as a sacrifice. You can say a little bit of that, but this word has been typically overemphasized and bringing too much negative connotation to it. Indeed, it's a generous gift of health or love or care, or all of them, because the donor is giving away a part of themselves. And it is indeed a big thing, giving your kidney, having your kidney removed. There are indeed some risks. We're not going to mention in this presentation today those risks, but indeed they are real, not frequent, especially if you are monitored by a professional team. And in theory, it's ideal you keep your kidney, no? But life is more complex than that. We're talking about someone in your close family, close love circle, might need your help. And that person being well off will benefit you back and many others. But we're not going to see that beauty if we just keep seeing in one direction. The truth is that not only the recipient benefits from kidney donation, but also the donor and the entire family or people close to them. For instance, a husband donating to his wife will simply have a wife for longer, who will be then able to take care of his children for longer, to give back love and care to him and to the entire family for longer, to contribute to the family chores and finances for longer if she works. And not only for longer, but also for better. Furthermore, the children of that couple, will have a complete family for longer, and likely a happier family and less stressed family for longer, knowing that the person who was significantly ill has regained a lot of health through the process of kidney donation and transplantation. Her brothers will have a sister for longer. Her parents will have a daughter for longer. Her parents-in-law will have a daughter-in-law for longer, and a happier son, the husband who donated, for all that, and grandchildren from longer, and so on. The society and the workforce can also have an active and functional or more functional member for longer. The same applies if the donor is the brother or the sister or the mother of the best friend forever of the recipient. Thus, living donation benefits everyone in the family or close to the recipient, irrespective of who the recipient is and who the donor is. Besides putting into the picture the beauty and the love behind altruistic or love-related donation. Because indeed, it's a huge act of love from the donor. I will call it more than that, a gift of health, a gift of love, rather than just call it a sacrifice. In a sacrifice, you are really just not obtaining anything. You are sacrificing. You are actually, if you help your loved ones, you will receive, besides the satisfaction, the fulfillment of that act, practical help, because your spouse will be there for longer and better. So you can have a wife, a husband for longer and better, because most people live longer and better on kidney transplantation than if just remaining on dialysis. Although we talk about exceptions, but so that is why I am an active promoter of living kidney donation, wishing the best possible health for my patients and the best possible health and happiness to their families. On top of all these, kidney transplantation through live donation, especially from family members, provides other benefits in comparison to transplantation from deceased donors, as we previously commented, due to many factors, but I will just repeat, just because at the moment I'm promoting that act because it's the best for patients, families. The benefits include the degree of organ compatibility is greater, therefore fewer chances of rejection and high chances of a more prolonged life of the kidney transplant when it comes from genetically related people in the same family, or there is time to do a better matching if it's like a spouse, etc. Also, since the organ compatibility is greater, fewer chances for needing higher doses of medications to prevent rejection and less need of the use of rescue anti-rejection medications, which are definitely more toxic, avoiding thus fewer chances for side effects. The quality of the donated kidney is higher as it comes from a healthy family member with more chances to function from longer. And if it comes from family, you know that, what is his lifestyle habits or her, and you know that, is a healthier person, etc. The kidney transplant can be performed promptly without the need for remaining for years on a waiting list for a kidney from a deceased donor. Because during those years on a waiting list, many complications can occur that can lead to patients' loss of health and loss of fitness to undergo eventually a kidney transplant in the future, or even suffer worse things. These benefits can be even greater if kidney transplantation is performed before undergoing dialysis, what is called preemptive transplantation, or as soon as possible after starting dialysis, which avoids the side effects coming from undergoing kidney, having kidney failure, and then the partially effective dialytic therapies subjected to them for longer and carry on dialysis, no? I can tell you that I am not only another kidney doctor in Singapore. I'm also a transplant physician and a transplant immunologist and a researcher. When I can, I also do some philanthropy. I am empathetic doctor. And I have heard and I have observed through my experience, all the struggles and worries people with kidney failure or considering dialysis, transplantation, having these concerns about life donation, etc., worrying about the well-being of their loved one. That is very kind that you as a recipient, you are worried about the well-being of the loved one. But most of the time, nothing happens, especially if done properly, etc., all the whole process of donation and transplantation. And if the person, is healthy from starting all this process. But that person is going to receive great benefits. For example, if it's your spouse, he will have you for longer and better. Seeing that, I always, obviously, balancing and weighing all the factors together with them and with their relatives. When it's clear that transplantation or live donation is the best option for them, I always encourage them to seriously consider it. And when I was, when I was seeing a lot of potential donors, when I was working in the government hospital, and when I applied that in my private practice, when I started, providing this different perspective, indeed many of these patients, many of these families start shifting their negative view of donation. Like it's just one way, like I should not accept that because I will be selfish, or maybe I'm giving too much risk, what if something happens to him, and etc. Indeed can happen, I'm not denying that, but doing it properly, balancing that, overall, the families will be happier and complete for longer if choosing donation, if choosing live donation, over just continue waiting passively on a waiting list for something to happen and given to them. An active process can happen faster, can happen in a more controlled way, and tends to go actually better, and because of the compatibility and many other factors. So when I have talked all this to many of those people that were reluctant or were hesitating, many of them shifted and they went and carry on with live donation, changed from dialysis to live donation, live transplantation, decided to talk again to their families. Some of them brought their families to talk to me, and then stopped waiting, waiting in the waiting list, and then decided someone to come forward and donate to their loved one. In the last video, someone asked about mindset and transplantation, so I'm going to talk a little bit about that. But what I wanted to give you first, what is my view on donation, what is my philosophy of donation, because indeed mindset is very important. That's mindset. If you think like, oh, it's just a sacrifice, I'm selfish, it's too negative, it's going to be very bad for the donor, you can just switch that by seeing the other perspective and probably given the right weight, especially according to your situation. But when you open your mind and to a different sort of mindset, to seeing the other perspectives or all the perspective or seeing the complete picture, indeed you can change your actions and you can change your approach. And indeed, the mindset can promote transplantation or can do the opposite. The mindset can promote donation or do the opposite. The mindset can help you in your self-care or the opposite. Your mindset can help you in taking better care of your family members, or do the opposite. We will discuss a little bit on that related about the consultation, although it's a delicate topic, you know. At the end of the day, no one wants to be told, you know, that maybe your thoughts are not right. I mean, we are humans, but sometimes we discover, even myself, I have discovered through life that sometimes no one carries the whole truth. And sometimes by sticking to certain way of thinking or certain thought, we are not seeing the whole picture, and we are probably devoiding ourselves of others from benefits. The mindset is very important. Even just to tell you, I managed to lose 10 kilograms myself with just shifting my mindset from one day to another. Just as an example, so how powerful is the mindset. I was telling myself I can do anything I do, anything I want, as long as I put my mind and actions into it, except controlling my diet. By thinking like that, I was definitely putting myself into failure to control my diet, control my health, etc. I already think I cannot control it, so I won't probably no point to try. But when I noticed that actually I was jeopardizing, I was self-sabotaging myself, my efforts, by thinking like that, and it's not real reality that I was not born unable to control my diet, and this is the proof. But when I discovered that I was probably not thinking correctly, that was not the whole truth, and I was open to change that. When I say, yes, yesterday I didn't do it, but from today onwards, I'm going to do all the necessary to control my diet because definitely I can do it. It just took me 1 second to shift that mindset thought, and then I started doing it. And lost 10 kilograms, gradually, nicely, happily. But it just required that openness of mind and then commitment to the new cause. To put the necessary efforts. At the end, I didn't need to do huge efforts. Donation, indeed, is a big effort, it's a big give. Let's not call it sacrifice, but you understand me. It's a big thing, donating a kidney. But it might not be as negative as many people praise it. Even people that is actively promoting donation still call it a sacrifice, still is for the recipient. And sometimes they just perpetuating without even noticing. If you preach the wrong thing or you preach the right thing in the wrong words or in the wrong way, still you are not obtaining or benefiting people in the way they should. So when it is possible, when there is a donor that is, after thorough assessment, fit, there's a recipient that is, after thorough assessment, medically fit, when they know that is the best for their family to do it, but they do some hesitations, it's sometimes just matter of supporting them, encourage them, address empathetically all their worries, all their concerns. Some of these thoughts that might not carry the whole truth, or they might be still real, having worries and concerns, or even be kind. But sometimes the weight we are giving to them is probably not the appropriate. Or sometimes if we just see it until here, all the risks for them during the surgery, etc., but we don't see beyond what can benefit the recipient and all the entire family, and even yourself, for feeling happier of doing such a thing for a loved one, and having your spouse, your brother, for you for longer, for 10 years more than maybe if they were continuing on dialysis only, because that is the difference, sometimes even more years of difference in the overall average patient. Then it's like focusing on the short, not in the long term, and focusing on the obvious, painful big thing, and not seeing all the collateral benefits arising once you decide or have a mindset shift. So then definitely, if you need my help, I will be happy and honored to offer more information, because I'm a promoter of this, because I have seen what happened to my patients when they just remain on dialysis versus the one who go for a transplant in their physical and mental well-being and happiness, etc. So if you want my opinion, even if you are in a different part of the world, maybe I cannot give you, unless you engage me professionally, I cannot give you a specific opinion of your case, but I can just tell you the general things. Someone contacted me and I was trying to speak something about this, encourage this person to go for or reconsider transplantation. So I will be happy to help you on that. But indeed, it's a very long, detailed process. It needs to be, once you design, it to be done properly, and you need specialists in your own country, in Singapore, or me, whatever, but it has to be, done properly as normal. No, there cannot be any shortcuts. No, to be sure that it's safe for both the donor, especially when it's given such a big gift, taking into account all the things I mentioned, the immunological compatibility and other medical and social aspects, as well as family dynamics. No, sometimes by me talking to a few cases that I told the family came, I told them to bring all their relatives, etc. So sometimes by understanding what are the family dynamics, who is supporting economically, who is busier, who is about to marry, who is about to that. Also, you can select who is the best person to donate, especially when there are 2-3 potential members in the family. And by doing that, sometimes you diminish the worries of the entire family, because this is not just the recipient or the donor, as sometimes is isolated. Is the whole thing, and sometimes many of these decisions has to be taken together. Although there are conversations indeed that have to be taken separately, assessment need to be done separately, etc. But at least the initial decisions to clarify all these, you need to involve all parties and hear and address their concerns, their worries, and if it's very obvious that donation is this different from other types of transplantation or from dialysis, it's probably our duty as doctors to try to encourage them and support them every step on the way, every step of the way towards this path. So if you need my help, you know how to contact me. However, I need to say that what I am promoting is love related transplantation, altruistic transplantation. I'm not referring to commercial transplantation, because that can bring a lot of issues. I'm not promoting, and I'm not involved in any purchase of selling of kidneys. Because of this group, there are many participants already, and I have received a lot of requests about, that. I'm not involved. So I'm a big promoter of altruistically associated, love-related, family related, when there is no coercion, etc. Because everything is going to work better when done properly. Even the aftermath thoughts, feelings are greater than when eventually you just do it for a sum of money in either direction, donor or recipient. Yeah. So I'm here promoting life-related or altruistic donation, not because of economical gain. So, okay, now I have my glasses, so I can probably, from the camera, let me see, there is a comment. There's a comment. Pro-transplant consultation. Okay. Unfortunately, I cannot see the full comment. Okay, I can see it now. This is yes. This person, hello, Malik, commented that in Asia is a taboo. Okay. And he comments that in Asian some cultures believe that a person when dying must remain complete. Obviously, about cultural, religious, personal beliefs, there is a great variety, and all of them needs to be respected. No, if it's a cultural, religious thing, we should, even that we know is the best for transplantation. Transplantation is the best. We still need to respect what is the identity, the of persons, groups, people, cultures, nations, etc. No, we cannot really impose. We can, as I'm just sharing, but I given the opportunity for the receivers to reflect, to open their mind, and to be discerning to accept my opinion or the views of others. Indeed, that's very complex. No, if it's something very ingrained in the culture that you believe that you need to be gone, complete, and donation. If you really believe that, so simply you should probably not donate. But this is very, when we go into all these beliefs, it's very delicate, and sometimes because we cannot have the full understanding of people's own beliefs and other religions, other cultures. So sometimes it's better not to say. But what I tell you is totally fair. If I think like that and it's part of myself, part of my culture, I don't need to be imposed other things. And if that's a high priority over donation, and then we need to respect it. When now there will be other beliefs that, as I was telling you, that donation is too dangerous for the donor. Indeed, there can be some side effects. Donation is the recipient is only one who receives everything. The donor is a hero, yes, a hero, but it's just give everything away, and the donor receives everyone, and then you start seeing like a selfish, or the donor needs to feel entitled because give something to the other one. So in that, probably that's not the reality, and that's not the kind thing to think. But if it's our religious belief to think in such way as you have shared, I believe that has to be respected, and simply donation is the best option in the average patient according to the medical data, what I have observed, what doctors know. But it's not the only option. And that's another very important thing. As I clearly spoke in the other, there are patients that do very well on dialysis, sometimes even longer and better than dialysis patients. But typically are those dialysis patients that, started with certain fitness, maybe started younger, started to live a healthier life, active life, frugal life, following doctor advice. They took self-care as a priority. Maybe for some of them it was their own decision just because, or maybe because they didn't have a donor, or maybe because of beliefs like you are mentioning, etc. But indeed, everything is about the mindset. You can still go through dialysis very well. You can go through transplantation very well. It's not the only option. So also, I'm promoting, I'm telling you the benefits, but I'm not pushing anyone. I also never push my patients, despite I sometimes, I'm very excited, etc. But just my emotion, it's just my passion for this. This group is basically destined to help you to educate whoever is behind this. So like you can take better decisions with your own doctor, and if you want to choose me, you choose me. But that's a remote benefit that you can have if you want my opinion. But at least you have more armamentary to take care of yourself or to discuss things with your doctor, wherever you are, so that you can have less complications, what typically doctors worries, but importantly, less worries. Because it's how we process mentally our disease, what is actually affects us the most. All those worries, what is going to happen to me, what is going to happen to my family, if something happens to me, etc. Rather than just knowing that your kidney is not well, or sometimes it might not even, you feel it, but it's the worry of what can happen. So that's why when you see a more complete perspective of your disease, or doctors see a more complete perspective, a more humane, a more holistic care of their patients, they can do better. But it's true that everything is self-care. Sometimes I just tell you, you need to do this, you need to do that, because some things, if you don't do it, no one is going to do it for you. And everything starts within ourselves. But anyway, I was deviating a little bit from the mindset. Although some people now with increase of health knowledge are accepting living donation. So yes, I mean, there are many things. It's all thinking, etc. Now we start open our eyes for many things. We just need to understand everything is a process. Sometimes the change can happen like that. Sometimes it requires, but to acquire a community change, it has to start from someone. I need to change first, then the next one, the next one, the next one. If not, cannot. So, but if I think, if I just change my mind and the rest doesn't change, what's the point? Or if I collect the rubbish, if the rest doesn't do it, what's the point? But sometimes can be effective. So in mindset is like that. But now we're talking about mindset. So indeed, it's a very complex and delicate. So I'm not going to go much into personal beliefs or personal or cultural or religious beliefs. I'm not going to touch on that. Because I don't understand everything. Yeah, I have my own beliefs, my own religion. I try to be open-minded, but I mean, indeed, a person needs to, respect his or her own background and respect the background of the others. No, but I can talk a little bit about economical thing. No, that sometimes can affect the mindset and the worries. No. Sometimes some patients or families are too worried about the implications of donation, no, or the implications of going for transplantation, the cost of transplantation, no, and that sometimes pull them off the process, thinking, the surgery costs that, and etc. Indeed, focusing on the acute, in the early, in the imminent cost is going to look greater. But after that, the costs of transplantation are much lower, of the cost of dialysis, especially if you pay for it. And that can be also biased. There are also the mindset and the biases. If your government subsidizes a lot dialysis, indeed people is going to go more for dialysis or choose dialysis because it's the cheaper, not the better. So it's also to shift not only mindset, to shift the bias, but shifting the approach as a family, community, government, healthcare policies, etc. But just going back to the cost, if you just focus on the acute, seeing that it's a big lump, but you don't see what is the future, and knowing that yes, you're spending that money, but it's not a cost, you see it as an investment of your future health, probably you more happily are keen to spend that money on that effort or that risk going for a transplant than just remaining on dialysis as a default. In addition, all these interrelated, for example, governments or healthcare policies or subsidies that protect the donor or cover the donor, or insurance, cover the donor better, kill off one of the main financial worries. It's also a mindset worry, but it's a reality. I appreciate that, because many donors are worried, what if something happens to me? If something happens to me, I probably lose my job, or who is going to pay now for my kidney disease if I eventually lose the single kidney that I have? Who is going to pay for that surgery? If I donate and I give my kidney to someone, will I be indeed seen not as a hero, but being appreciative? And if something happens to me, I will be covered. That will be totally fair. I'm pro of that. There are apparently governments that they do something like that, and that, kill off that worry and promote a little more donation when that is the worry. If the worry is different, you need to address the worry. So that's why it needs to be targeted. But in governments, healthcare systems, when the donor feel unprotected in case something happens to them, or there's no insurance that cover them, or there not be that subsidies, or the government or etc. is not going to pay for the kidney failure just for that risk, they have a lot of hesitation, and it's because of economical triggers, economical factors, ingraining a mindset that I should not do it, because if something happens, indeed, not only me, but whoever is dependent on me will be totally affected. So there are factors like those that I can comment, and sometimes we can address it, sometimes by addressing in the way that it's an investment, that telling that indeed if you are healthy, the risk is very low, and you just need to live a frugal life, etc., and let them see the importance of donation, etc. Then they can open the mind to take that jump, that leap of faith, and that risk. It's real, but it's probably not as big as they might think. But if at the same time governments trying to promote donation, promote transplantation, if they don't appreciate or realize that, and they don't do the necessary to shift the biases, to help people shift the mindset to pro-donation, because you are protected. We are protecting you if something happens to you, so you don't need to have the worries. We are behind you. Just help your loved ones, help your fellow citizen. Because as I told you, even the government, the community is going to have a more functional individual. So it's on the sake of them, because that person is most likely to continue working on transplantation than on dialysis. So, and be economically active as well. or being able to take care of people that eventually are able to be economically active or become a doctor, become a president, become a lawyer, become a cleaner, that we know how important all those jobs are. So promoting the health, prevention is better than cure. Promoting the health, promoting something that is beneficial for the individual, for the family nucleus, for the community as a whole, and even for the health economy, the government, even the dialysis could be cheaper because of the subsidies. The government end up paying more on dialysis than on transplantation. And the government and your taxes, you pay also more taxes that are spent on dialysis than if they were to spend on transplantation. Because the costs are like that, transplant surgery, and then like that, and then maintains. Dialysis is lower, but persists, and a higher, because dialysis is very costly. And not only dialysis, all the complications arising from dialysis. So, and there are some biases. Have heard of doctors that, have dialysis centers. The stories, so they don't promote so much transplantation because they want the patients to go to the dialysis centers. There have been stories in the world, or doctors that maybe don't understand fully the benefits of transplantation, or they don't have time to discuss it because too busy at the length that I want, at the length that I need, at the length I think my patient, their family deserves. So that could be also sometimes bias in the decisions of their patients. Have received many patients from other countries, or even from the country I'm residing, that they claim that they have never been told about the option of transplantation or the option of donation, or they are aware but they never were told more about it, or they never ask. That's also important. As I told you, it's self-care, etc. If your doctor don't tell you, ask them. We need to self-care and ask for help. No shame asking for help. No shame to ask. When I need help, I ask for help in many other things. So indeed, mindset, positive or negative, has a reason. The mindset has a reason, but sometimes has overrated in the positive or negative side because we have failed to see beyond, or we have failed to appreciate all the other perspectives. And mindset can be changed from one moment to another, but it's not only the personal, it's also the communal mindset, and requires a change of culture, change of approach, changes in policies. It requires that everyone is connected and everyone sings the same song and walks in the same direction, and not just speak the same thing. And what happens sometimes, many people just speak the same thing, but they don't walk. They don't walk the talk. Or sometimes I appreciate the walk is not as simple as, I'm not trying to imply that. It's not as simple as it appears, but it's not impossible. It's not like I said when I wanted to lose weight, that I was telling myself it's impossible to lose weight for Francisco. I was just telling myself a stupid lie. And I believe it, and it was self-created and empowered by the environment that give you those, that they create those beliefs that, it's only for certain people, it's only for, no. It was just for me, and I just say, that's not true. Shift it, and I do it. The same, say, okay, yeah, oh yeah, indeed, if I donate to my wife, if I sacrifice, no, let's call it that, but let's say use the same term. If I sacrifice to my wife, definitely she's going to continue cooking for me. She's going to, yeah, I'm going to receive benefit back, plus the satisfaction of helping my loved one. So I don't need to worry too much about many other things. Then indeed it's not a sacrifice, it's a gift. Indeed, I'm a hero, but actually we are our mutual heroes. Indeed, my wife is going to live longer, but we're going to live longer. We're going to live, my wife is going to live better, but we are going to live better. Sorry, someone is ringing the bell. Let me see if something urgent rings a couple of times. Never mind. Just in case it was something urgent. Gone. Yeah, that's it. So there are mindset, there are biases. Sometimes confounded. Sometimes need to be twisted. Sometimes right, but there is another right as well. Especially there are rights for different situations, or there are always options A, B, C, and D. There is not always option A. Or option T if Tammy say it, or option P if Perry say it. No, there's option A, B, and C. And there are sometimes that simply you just need to accept it. If it is really ingrained, and going otherwise can really hurt the feeling of belonging in a culture, in a religion, the integrity or the self-worth of a person. So if it's like that, it's not also no point to push boundaries as well. We just need to respect. There is option A, B, and C. There is kidney donation. There is disease donation. There is hemodialysis. There is transplantation. There is peritoneal dialysis. In some cases, just continue with medication, supportive, palliative care, etc. So there are options. Okay, so I hope all that address that question of mindset. It's more complex than that. I just, but you just matter to accept that mindset is crucial. Mindset is biases can cause you to decide something or the other. And when I have helped all those families, by was I helped them in changing the mindset. So I received a call. Unfortunately, I'm going to see what is that. So we end up here, and Dr. Francisco wishing you the best possible health. Take care. Bye-bye.